Sounds. Thank you, Priscilla. I was just going to ask if you could start recording the meeting. Well, hi, everyone. Welcome. My name is Danielle Baumgartner. I'm a senior project coordinator at the Michigan Public Health Institute at the Center for Strategic Health Partnerships. We call it CSHIP. That's our department at MPHI. And we're really happy to have you all joining us. Today, we'll be going over this MICC Bring a Friend meeting. We're going to talk a little bit about our project, what we've been up to. I see some still familiar faces, so thank you to those who are joining us. I'm going to share my screen, and we've got a little PowerPoint presentation for you today. And I will also say, you know, and at any point, if there's any questions, feel free to utilize the chat or raise your hand feature. We have a lot of things that we're going to kind of be going over and showing you all some videos and things like that during this presentation. So we're really excited to get started. So again, welcome to everybody. I'm going to share my screen here. Hey, Drusilla, can you message Jane on how to get onto this meeting?
Yes, I'll do that.
Thank you. Can you all see that PowerPoint?
Yep.
Okay, let me put it in slide. So again, welcome everyone. We're really happy to have you all join us for the Michigan Innovations in Care Coordination Project's Bring a Friend meeting. Today we're going to be doing a little bit overview of what the MICC project is, what we've been up to over almost the last 2 years, and how we've gotten to where we are right now. We're going to review some of the materials that we've developed, and then we're going to have a little opportunity at the end to discuss how this applies to you. So I'm just going to do a few brief intros, introduction slides, and then I'm going to turn it over to Christina Clancey, and she's going to walk us through kind of the ins and outs of this project. So this first slide here, our director, Matt Edick, who isn't able to join us today because we made him take a vacation. He's actually on vacation. He calls this the golden circle, where we talk about the why here in the middle and kind of why we do what we do at the Center for Strategic Health Partnerships. Our goal is to improve health outcomes through strategic partnerships. And the why we do this work is because all individuals do not have access to the care they need to achieve the best possible health outcomes. And because of this, we give clinicians, families, patients, community leaders, and any other relevant stakeholder a voice at the table. And that's what we've done throughout this MICC work, and that's what we've tried to do to lay the foundation for this work in developing and implementing and disseminating strategies that are relevant and important to all stakeholders. This is a infographic that we developed at the very beginning of this project, kind of laying out what our objectives are to improve access to coordinated and integrated care for children at risk for ASD/DD. The target population for this work has been medically underserved families in Wayne County, Michigan. And the goal is to build up a community of care, to develop collaborative partnerships, learn about best practices, and share success and challenges. We started this work through the establishing of 2 groups. We established an advisory board, which I see some of our advisory board members are on today. Thank you all, who will oversee and guide the direction of the project work. We also established a provider education work group that was also helped to plan, develop, and implement educational activities for providers and families. And the groups met about monthly and every other month throughout the last 2 years to kind of work on this project and help guide and direct the work of the MICC project. The outcomes we hope to achieve are that providers will be educated and trained on providing timely evaluation and services for children in their care, and that stakeholders will create a learning community comprised of providers, family members, and other stakeholders focused on improving care coordination. And so that the at-risk children who can receive timely identification, intervention, and coordination of services. And one of the key components of this work is that family members were supported as equal partners in establishing a collaborative system of care. I don't know if I see any of our family partners on today, but they have been integral in kind of this work and helped review all of these materials and provide us some strategic direction over the last 2 years. So we're very grateful for their participation as well. And I can stop here. This is sort of the overview. I don't know if anybody has any questions before I turn it over to you, Krista.
Okay.
All right.
Well, I think I'm going to go ahead and pick it up from here. So for those of you who do not know me, my name is Christina Clancey, and I am a lecturer at Wayne State University, and I oversee the ABA program. And I've worked in the field for quite some time, doing work with autism and ABA. And this particular project is really close to my heart because I've just kind of gone through a lot of struggles as a provider to make sure that, we're doing the right thing, to make sure that families are getting access, and kind of through the years and kind of getting ABA as part of, public health knowledge and making sure that people are aware of these services. I've really encountered a lot of barriers to families in getting into this early intervention at an early age. So there's really a big difference when you're thinking about getting kids into services before the age of 3 and then getting kids into services at a later date. And one of the things that has been really important about this project is really kind of highlighting what that is. And the other thing that I think is important about this project, and this will kind of come to light as we go through these different processes, but the system of care for people with autism is extremely complicated. And when we think about what that system of care looks like, there are so many different people involved. So obviously the parents are involved, the medical providers. So sometimes you're dealing with pediatricians, you might have neurologists, you might have other therapeutic people that are involved, like speech and language pathologists or occupational therapists. Sometimes folks at the schools involved, depending on the age of the child and whether or not they started to identify that there were some concerns when they entered school or before they entered school. So we really had all of these people. And then on top of that, there are multiple systems that people have to work through, both providers as well as parents, and things are different, whether it's Medicaid insurance or whether it's private insurance. There's a lot of things that have kind of changed along the last couple of years. So we also really wanted to bring partners to the table that were really from all of these areas, but also including people from the state and some of these payer organizations. So just to give you an idea of the organization of the project, I partnered with Matt, who Danielle was talking about a little bit earlier, and we kind of co-partnered as directors on this project. I come from the world of autism, as I said, and he has had a lot of experience doing a lot of work bringing parents and professionals together on some other projects. So I think it was a really great partnership. And together we recruited families, clinicians, public health professionals, other organizational leaders, and we got them into the same room. So as Danielle said, we had these two different groups. We had our provider education group, which is kind of like our boots on the ground people. We had a lot of ABA providers. We had some diagnosticians. We had some physician representation in this smaller group. And our advisory board kind of were all of these big community leaders and people that really kind of have their hands in a lot of different areas. And we really used our advisory board to kind of get additional ideas, kind of bounce some things off. They reviewed a lot of the materials that the provider education work group was kind of coming up with and completing. And together we kind of walked through this process and tried to really figure out, like, what are some of the barriers and what is it that we need to do to really help our families as well as our providers help get people into the system and get access to services before the age of 3. So all of these partners came from universities, clinical centers. Many people were from MDHHS. We had some other representation from some different local and statewide organizations. Like I said, people that were representing autism, people that were representing ABA, people that were representing like some of the payer organizations. So that was complicated enough, just kind of getting all those people into the same room and kind of getting all of their ideas out. So go ahead and advance the slide, Danielle. The next thing I'll talk about is just kind of like, how did we come up with the ideas of what we were doing from this project? And really what we wanted to do is evaluate our providers and our families and get as much information as possible. So we did two things. We did a formalized assessment that we actually sent out to our provider groups. And we also had a lot of very rich discussion with the people in both of these groups. Family members were also part of these groups, and we really tried to get as much information about their experiences as possible. So we really wanted to determine, like, how is this affecting everyone? And what we came up with is a list of barriers, and that's kind of where we started. So there were really barriers in 3 big broad categories. And we identified providers or barriers that providers were experiencing, family barriers or experiences or barriers that families were experiencing, and then barriers that were kind of associated with just understanding and navigating through the insurance process. So within the area of providers, one of the things that we identified is that providers really didn't know a lot about what happened outside of their own service. So providers really didn't, there's all these different people involved in getting people with ASD kind of through the system and evaluated and into services, but none of those different providers were really talking to each other. So there wasn't a lot of tracking or information of what happened after the screening, and then what happened when the child went to go get a diagnosis or an evaluation, and then did they get into services, and people just didn't know. And that was a big concern. One of the other concerns that were brought up were wait lists and referral wait lists. Like, how do we navigate that? How do we deal with that? The other thing, again, kind of going back to these multiple service providers, they really didn't understand the roles that all of the other service providers played. So what exactly does the pediatrician do versus the diagnostician? What happens when they go to private insurance versus Medicaid? What are all the different roles of these people? And that was something that was pretty confusing as well. In addition, kind of thinking about that, how do these people communicate with each other, and what are some of the barriers that are associated with gaining that information? In addition to that, our providers knew that there were resources out there, but they weren't really sure what resources were available, what resources were good, what should they refer families to, when should they refer families, all of those kinds of things to try to get families the information that they needed. Our providers were reporting that they weren't really clear and didn't have a lot of solid information on that. In addition to that, the providers also had reported some difficulty with the process in general. So understanding the process to get them from point A to point C or D or E or however many points there are along the way was something that was difficult. And as I said, there have been many changes kind of along the way since ABA has been offered as an insurance-based intervention. So kind of navigating what things are currently in place, what do we do, how do we navigate the changes? And then finally, the ability to really identify quality providers and know how to get people into services with those quality providers, as well as the providers really weren't spending much time tracking patient satisfaction. So how are the patients responding to the service, and reporting a lot of like dropouts or people who leave and go from one agency to another. So obviously there were some issues with that. The other thing that we looked at, as I said, were family barriers. And with the families, some of those things were similar to the providers. So some of the things with the multiple providers, such as difficulty communicating with all these different people, not really understanding the process, having this extensive wait list. So there's a lot of commonality between what the providers and the families were reporting as barriers. In addition to that, the families did say that they had a lack of resources for information, like where do they go for information? What information do they trust? How do they get that information? And then also there were some transportation issues that were reported as well as a barrier. For our final group, the insurance area, as you can imagine, we had mentioned changes in insurance requirements. So that was one of the things that was targeted as a barrier, as well as just understanding what are the requirements, period. What are the differences in the plans? How do we get to the insurance evaluation? What's covered, what's not? And what is this entire process? So lots and lots of things that people were kind of talking about in these groups that are likely to be impacting a family's ability to get access to services before the age of 3. Danielle, you can go ahead and go forward on the slides. So out of all of that evaluation, again, kind of going back to the why is we wanted to make sure that families were getting access to services. That's the big picture. But in order to get there, we kind of had to break it down into some smaller, like more achievable goals. So the things that we had decided to look at were improving workflow process for providers because of the complicatedness and not being able to kind of track and know who's, in the system and who's not. We also decided that we, as a group, should evaluate what the current resources are for families and then help providers identify what are the most helpful resources to refer to families so that they can easily get that information out. In addition to this, in our in our review of kind of what was out there, we did determine that we wanted to create some additional resources, things that would help empower parents, as well as help them to kind of navigate through the system of care, some things that were kind of simple and easy to use. And then we definitely wanted to improve parent engagement with the providers and the resources. One of the bigger reasons why families were not getting into services before they were 3 is there were lots of steps and they were kind of dropping off along the way, is one of the things that the providers were giving us some information about. So we wanted to really improve that parent engagement with the different providers and making sure that we kept them in the system. And then finally, we wanted to create some educational resources for providers themselves, things about the system of care, as well as some things about diversity and really understanding individual backgrounds of families. In particular, we were targeting people in the Wayne County area, and Wayne County is a pretty diverse population. We have big pockets of people who are African American, Arab, Indian, all of these different cultures, and we don't always understand or come like into that therapeutic relationship or that medical relationship with cultural humility. So we wanted to really consider that as part of our resources and making sure that providers were educated about that. And we can go to the next slide, Danielle. So based on these goals, we came up with some very specific products and tools that providers can use to connect better with families and to hopefully keep families more engaged. So I'm going to talk individually about each one of these things, but we created some parent education videos. We created an insurance guidance document. We created an ABA guidance document. We also created a resource repository. And then we created 2 surveys that can be used by providers or by payer networks. So one is an ABA provider survey, and then the other one is an ABA consumer satisfaction survey. And then we also created an electronic MChat survey. So we're going to talk specifically about that a little bit later and how that works to improve the workflow. And then we've been working on some provider trainings. This is one of the things that we're looking at, but also some other things that are more specific to administering the MChat and utilizing these tools. Go ahead, Danielle. All right, so what I'd like everybody who's online right now, so right now we have 22 people online participating in this. I'd like you to all get your phones out, and I'm sure that most of you know how to do a QR scan. So I'd like you to open up your camera and I'd like you to scan that QR code because that's going to take you right to our website. And Danielle, if you want to just quickly open our website and I'll show people where they can access the services that we have ready right now. All right, so this is what the website looks like, improving access to coordinated care. We're going to go through more things than are listed on here, and hopefully within the next month or so, we're going to have everything on here that we've been creating. But right now we have a couple of videos, and these are our educational videos. And then below, you're going to notice it says MICC Resource Repository Table of Contents and MICC ABA Treatment Guide. Those are PDFs. And if you want to go ahead and just click on one of them just to show them, and it will take you to a PDF, and I will be explaining what all of these things are. But if you guys want to, it would be really great since you're on your computer, maybe you can bookmark this, or maybe you can save it to your phone so that you can kind of come back and utilize these resources at a later date. But we can go ahead and go forward, Danielle. I just wanted to make sure that, everybody was able to access that. And hopefully by the end of this presentation, you're going to want to use them. You're going to want to share them. You want to get all that information out to the parents and the other professionals that you're working with. Okay, so go ahead and go forward to the next slide. And what I'm going to do now is I'm going to go through each one of these individual resources. Before I do, I want to pause real quick. I don't know if anybody had anything in the chat or if anybody has any questions on our process or what we did to kind of get to these products before I go on and describe each one of these. So I'll just pause to see if anybody has anything.
I did just add the link to the website into the chat.
Okay.
Thank you.
All right, so I'm going to go ahead and get started, and we're going to talk about each one of these resources that I had listed on the previous slide. And then hopefully, like I said, you guys can really be thinking at the end of this presentation, we're going to talk about like, how do you use this stuff, and how do you like envision like what is it going to look like to try to utilize this within your own work or your own experiences. But for right now, it's kind of an introduction. So we created 4 videos. We have 2 that are currently available, and we have 2 that are currently in production. So we're hoping that in the very near future, we should have video number 3, because that went in for kind of our final production. And then we're just tweaking the last parts of the script for video number 4. So we're hoping that those are going to come along soon. But I want to review what's on each one of these videos just to kind of give you some background of how they might be utilized. And then Danielle's going to show you a little clip of one of the videos so you can kind of see what they look like. Our biggest goal with these videos is we wanted them, again, our focus with this was parent engagement, and it was navigation, making sure that parents knew how to make decisions and kind of problem solve in a very quick and easy way. We wanted all these videos to be pretty short, so they're all about 5 minutes-ish. We wanted them to be parent friendly. We wanted people to see themselves in the videos, so we have a lot of diversity. We made sure that the language in the videos was easy to understand, easy to follow. And again, the videos are fairly short so that they're very easy to watch and can be done in a very short period of time. So the very first video is My Child at Risk for Autism, focuses on the MChat. It focuses on what the MChat is, what it means, why we do the MChat, and then also what it means to have autism. So it goes through some of the autism symptomology and what you would do potentially if you did have a diagnosis, and kind of talks about a little tiny bit about what those next steps are. The second video gets a little bit deeper into this. So this is Autism Evaluation and Applied Behavior Analysis Services. The autism evaluation kind of says, okay, so you have a positive MChat, or you have an MChat that has showed some concern, and your child might be at risk for having autism. So what do you do next? And it kind of walks through the process of getting an evaluation, what that evaluation is, the different options between what it might look like if it was a private insurance evaluation versus a Medicaid evaluation, and then why it's so important to get that evaluation, and what the difference is between the MChat screening, which is just like the very first step, and then what that actual evaluation is going to tell you. So that's what we had for video number 2. Video number 3 talks a lot about, okay, now I have a concern, what do I do? And it educates parents about early intervention. Really what the difference is between early intervention that you might get like through Early On or Build Up Michigan or some of those school services, and what intensive early intervention is. And kind of encouraging parents to start looking into these things now, even though they don't have a diagnosis of autism for their child. There are a lot of services out there that they might want to start to look into, because regardless of whether or not the child has autism, there's still a concern. So it's kind of a good idea to get rolling on that. And then the final video is a video that's specific to applied behavior analysis and better understanding why you use applied behavior analysis, what that is, and why it's so important to utilize that intervention. So those are our 4 videos. Does anybody have any questions about the videos? Okay, well, let's go ahead and show a little clip so you guys can get a little taste. And of course, afterwards, when we're all done, feel free to watch them in their full length 5-minute feature for the first 2 that we have.
All right, so I believe everybody should be able to hear my sound. I've shared my sound. So give me some nods if you guys are hearing it, and we'll just push play on the first video.
Because you have questions about your child's development. The way your child grows and learns paints a unique picture for every family. From the moments when they take their first step, to that day when they say their first word, and until we see them grow into their own, we as parents are always observing our child's progress. You might wonder, is my child falling behind in their development? Should I be concerned that they aren't talking as much as other children their age? At what age can I expect for them to start being social? Or, Is it typical for my child to have difficulty calming down during or after temper tantrums? It's important to monitor our child's development so that you and your care team can provide them with the tools they need to become their best selves.
All right. So as you can see, there's simple language, easy to understand concepts. There were things that were highlighted in the videos, like you could see like important words that kind of popped up. So it would help people to really think about certain things. So as I said, please feel free to take a look at our videos, and we've got video 1 and 2 up there where you did the QR code. So take a look at those when we're done, and then we should be able to have the other ones out shortly. Since you guys all registered for this, we should also be able to send you an update when everything is available. So we'll be kind of sending things out, and we've also been using some of our social media to send that out. All right, so we're going to go ahead and move on to the next document that we created. All right, so we're going to talk a little bit about the insurance guidance flowcharts and the insurance document that we created. So as I had mentioned earlier, there was a lot of concern as far as people's understanding of insurance and how to navigate insurance, and that being one of the barriers to getting kids into services. So we put together some different flowcharts that kind of helped people identify whether they had private insurance, whether or not they were navigating through Medicaid-based insurance, or whether their insurance did not cover autism services or they didn't have any insurance at all. So we put together 3 flowcharts, and within those flowcharts, we also referenced other resources that were available that kind of explained in more detail certain things. And these are meant to be partnered with our other information. So our videos and things like that, this is kind of more of a resource or a supplement to that. And it can be used for parents. It could also be used for professionals who aren't quite sure about the different insurance, pathways that they would have to take. But this would be something that families would be receiving after they had a positive MChat or an MChat that has concern on it, so that parents can reference this to navigate that a little bit better. And Danielle's going to open up one of our flowcharts just so that we can look at it with a little bit more detail, because it's a little tiny box there. And I just wanted to give you guys a little bit more about that. So as you can see, I mean, the insurance process is extremely complex, and this is something we've spent months on, no kidding, like months, just trying to pare this down and make it simple for families. But it kind of shows like in a linear order, like what do you do? So for example, if you're going to call the local community mental health agency, it kind of gives some direction on what you might do. So there's a website here that links the person to all of the community mental health agencies, and it kind of opens up so you can select by county, and then that kind of helps people no matter where they are identify who they need to call for that process. And then after they do that, they get an appointment with a supports coordinator, and then you kind of go down the flow chart. It says, okay, then if an autism diagnosis is suspected, then there are other steps that you have to do. And one of the nice things in here is there's a lot of complexity within timelines as well for the Medicaid services. So we also added in the deadlines, and that I think could be important to parents and professionals to know, like, how long do I expect that it might take from the time that CMH submits the results to the state, Michigan Department of Human and Health and Services, to determine whether or not I'm actually going to be approved for a benefit. And it could be up to 30 days, although it often isn't. They do have that timeline to be able to make that determination. So as you can see, there's some things that happen, and some of these things are linear. Some of them kind of all happen at the same time. So we tried to break it down as simple as possible and get families, as I said, this isn't something that you would just read through all of the things, but it's more of a reference. It's something that you can use as a resource as you're kind of going through the process. All right. Does anybody have any questions on our insurance document? Okay, well, let's go ahead and go forward. And we're going to take a minute to take a look at our ABA guidance document. And Danielle is going to open up the table of contents. And if you want, you can go ahead and do that now while I'm kind of giving them a little background on this document. This document was developed because as people were looking into applied behavior analysis services, one of the things that some of the providers had brought up within our groups is people are often very confused, not only at what the services are, but at the differences between the different ABA providers and why they might make a choice on one particular variable or another. So again, kind of really educating the families on what are the different things that they might want to ask, what might they expect when they, are talking to an ABA provider. Typically, like any other doctor or any other therapist, families are calling up providers and they're kind of interviewing them to determine, hey, is this going to be a good fit for my family? Now, the families that tend to do that, they tend to stay with their provider. Some of the families that don't do that, or they don't really know what they're getting into, they might what we call provider hop. So they might start at one provider and not be satisfied and then be looking for another provider that kind of better fits their needs. So can you make that just a little bit bigger, Danielle? So this is our table of contents. So within this document, we have some sections, just how do you get started with ABA? What's the initial ongoing process? So with ABA, not only do you have to come in with a diagnostic evaluation that says, yes, I actually have autism, but you also have to do additional assessments so that you can create an individualized treatment plan for that particular child or client that's coming in. So there's another assessment that families have to do. And often they get like a little bit shell shocked, like, oh, another assessment, what's this? So this document kind of explains that. It also talks about some different treatment plan options. So sometimes families go into a more intensive applied behavior analysis approach, and sometimes they don't. It depends on a lot of different variables, and those things are also discussed within this document. Then we kind of get into what are the different logistics of different ABA providers, like how do they schedule these meetings and therapy sessions? Do they do in-home? Do they do center-based therapy? Do they go out into the community? How does ABA work if my child's already in school? How do we work together? How do we collaborate? What does that look like? What other services might I be expecting to have? And then how does ABA work along with that? How do we coordinate care and what should I be asking? And then some things on culture and background, like, do you have anybody who speaks my language? Do you help with translation of documents and, different things like that, that sometimes families are also concerned about. And if you can scroll up just a bit. Yep, there you go. The next section is talking a little bit more about the clinical aspects of services. So clinical staff information, like a lot of times families are confused by all the different staff members that are in an ABA agency. So like, what is the technician and how are they different than the BCBA and who's supervising and what does that mean? Also, some providers are going to offer individual sessions. Some are going to provide group sessions. Some are going to provide both. So talking a little bit about the benefits of what that looks like and why you might choose an individual versus a group session. In addition, talking a little bit about parent training. And this is important both for knowledge for the parents, because not all parents realize that there's a big parent engagement component within applied behavior analysis, but also so that they should expect that, because if a provider isn't necessarily giving that parent training, it's something that parents want to ask for. And then toileting is such a big deal that we thought it was important to kind of deal with that in addition to all of the other clinical things, and just kind of talk about some of the aspects of toileting and how that works, at different locations and whatnot. And then finally, telemedicine and what you might expect from that and how it might be different than individual therapy that you might be doing live one-on-one. So we added that as well. And then at the very end, we have a glossary. And the glossary just kind of highlights all of these different alphabet soup terms that we kind of use in our therapeutic world. So that way the parents can reference that. They have a good place to kind of go and define things as well. Okay, does anybody have any questions about our ABA guidance document? Okay. Let's go ahead and move on to our PEG table of contents. And actually, if you want to just open that document, that's fine, instead of going back to the PowerPoint. So one of the other things that we mentioned early on within our evaluation results is that providers and families didn't really know, like, okay, what's good information? How do we know how to send people information that's useful? Exactly what do they need? How do you sift through everything that's on the internet? So we, in this particular document, this partners with something that I'm going to talk about a little bit later, which is PEG, Patient Education Genius. So kind of stick that in your brain and we'll come back to that later. But we did identify resources that families need. And Danielle, if you want to maybe just kind of scroll through the different areas. So in the beginning, we have the ASD and ABA education, and there's a lot of stuff in there. There's stuff that you can access just about, you know, things that are going to help you understand those things better, things that are going to maybe help you do things with them. There's some nice toolkits, like what do you do to get started with ASD? We also added on here the ASD service directory. So we did partner with the Autism Alliance of Michigan. I know, Colleen, you're on here, so thanks for coming. And this is an invaluable resource that families can use both for navigation services as well as just kind of getting a directory of resources in the community. Because a lot of times families are like, well, where do I find a provider? Where do I find a speech and language person? Where do I find somebody to help me with my finances? So we put that on there. And then we also created a little YouTube. One of the things that I always found is that when I work with families and providers, they don't know so much about the directory system. So I did a little demo, like a 2 or 3 minute demo, just to kind of walk people through how to do a search for different services. And that we posted on our YouTube channel. We also have early intervention and school-based intervention services. So kind of directing people to, as they're looking for, like I said in video 3, as they're looking for those early intervention services, where can they go? How do they discern what's one type of service versus another? We also have family advocacy and support. So lots of different things on here. Some of those things have to do with autism. Some of those things have to do with other types of things like crisis lines and financial resources and a variety of things that are on there as well. And then we also had identified a few like parent organization groups, and we just popped those on there. Also financial support, sorry, the financial support was a separate section. So these are a lot of different resources. If people need supplementary income or other kinds of support subsidies that are available for people with disabilities. And then below that, we have Medicaid and state resources. So actually, the state has created so many different autism related resources, and we added all of those things. A lot of people just don't know where to look for those. So we added those things on here so that families can also get access to that. And then, is that the last one on there? Nope. And then we have our own MICC resources. So then there's links to all of our videos. And then we have private insurance information. So where can you get information about that? And then I think there was another, yep. And then provider resources. So these are things that providers might want to look at. They might want to get access to so that they can educate themselves or learn more about different things that are related to autism. So as I said, I'm going to bring this back up in a little bit, but this is really to kind of help guide people to, all right, here's some information that we think is useful that you might want to access, and then try to utilize that. So Jenny, I see that you just said, how often are these things updated? We just created this, and so they haven't been updated yet, but we did talk about MICC kind of housing this information and looking at how to possibly update this. Danielle, I don't remember if we determined a timeline for how often things were going to be updated, but I know we were talking about in our sustainability plan how that was going to happen. Do you have any additional information on that?
I don't remember the specific date or the timeline, but I think that is something that we'll continue to discuss in terms of sustainability. I do know that we made an intention to, not to link to sites that might not change very often, like to not have it, come to a website that might be, I think it was the clinical piece, right, Krista? We didn't direct to any clinics or any information specific. It's like all educational resources, right?
And particularly like things like putting the Autism Alliance directory on there versus having a bunch of, things that might be changing. These are kind of stable organizations, or hopefully stay in this day and age, we don't know, but these are kind of stable organizations that have been working with families for a long time. So hopefully they won't go away and it won't take too much work, but we will be establishing a process for that.
Just I have another question.
Sure.
Can these be sorted by free services? Because sometimes it costs a lot and people just get turned off. So if there's a way, you've done a lot of work in this is good, but wondering if there's a way to sort it by free services, make it easier to use.
We really tried to not put service providers on here. So to my knowledge, these are all like...
Oh, I was referring to the toolkits. Sorry.
Oh, the toolkits. I don't think everything on here, I believe, is stuff that you don't have to pay for. I clicked on everything. I looked on everything. There might be other things that maybe the organization offers, but everything that is directly linked for, I don't believe there's any cost associated with any of these things. However, like, let's say you want to go to the Behavior Analysis Association of Michigan conference, then you would have to register for that. But they do have some general information like on each of these areas just on their website. So you shouldn't have any cost just to get the information.
Thank you.
You're welcome. Any other questions about our resource guide? Okay, let's go ahead and move on then. So the next thing we're going to talk about is we created two surveys that could be used, one for our providers and one for our families. So the provider survey is something that we actually created so that information could be given to families within, these are all providers, at least the ones that took this survey, on families that are connected with Wayne County Community Mental Health. So they have contracted with, I want to say 14 or 15 different providers, and they sent this survey to their providers within their network. And then they gathered information, because one of the things that happens is once you kind of get into the point where you're like, okay, so now I know my child has autism and now I need to select ABA services. Now, what do I need to know? And a lot of times the websites don't have information that you really want, and the networks don't always have information. So the parents are picking up the phone and they're calling all these individual providers, which takes a lot of time. It can be really difficult and confusing. So this is kind of in collaboration with our ABA guidance document. And we ask providers some of the pertinent questions that parents might want to know, things like, how many languages do you have available? What kind of insurance do you take? What are your hours? Do you have additional services? Do you have, like, how do you accept clients? How do you schedule clients? How do you do your training and supervision? How do you coordinate care with other providers? What kind of assessments are you using? How are you engaging parents within therapy? So the providers took a survey that probably took them, I would say, maybe 20 minutes or so to fill out. It's detailed information about their organization. And then the families can get access to this when they have to make a choice of which provider they want to choose within the DWIN network, which is Detroit Wayne County. This survey could be available to other networks. It could be available to private insurances. It could be available to individual organizations. If you work at an organization and you want to better inform your families about the types of services that they have, so that way when they select your service, they're getting the service that they really want. This could very easily be something that you could utilize to assess your own services and kind of get that information out. We do not have this posted on the website yet. However, Danielle, I was kind of thinking earlier today that we should probably create a PDF of this that could also be posted. And if people just wanted a paper copy, that might be something that would be useful for them. But I do think that we could definitely get that onto our website in some sort of a form. But I will talk to you a little bit more about how this is embedded into the PEG system once we get to that. So I'm going to go ahead and go forward and talk a little bit about the other survey, and then I'll see if anybody has any questions about those two surveys together. So the other survey was targeted towards families, consumers of ABA. So it has a lot of questions about general satisfaction, how were families involved in treatment, how prepared were the staff, did the family feel like they had a good relationship with the staff? What kinds of education was used? Did the parents feel comfortable that they understood what was going on? How easy was it to access the location? And then overall effectiveness of treatment and improvement. So this is also a survey that we collaborated with DWIN. And the goal is that when they complete their treatment plan, so treatment plans with ABA providers are usually about 6 months. And then when the family has been with that provider for 6 months, they would then receive this ABA satisfaction survey, which would then allow DWIN to take a look at what's going on with the providers within their system. Again, this could be something that could be available for providers. It could be available for other organizations that coordinate with networks or have, a group of provider networks. So we would be really interested if anybody on the call today has any interest in utilizing these things. How could we better get this information to you? So again, we might be able to add something to our website, but this is kind of giving some information about how are the providers doing according to the parents? So that's our ABA Consumer Satisfaction Survey. And I'll pause for a brief second. Do we have anything in the chat, or does anybody have any questions for me? Okay. Well, if nobody has any questions, we will keep moving along. And as I've said PEG several times now, I'm going to describe a little bit about PEG, which is a partner that we also included in our stakeholder groups. And this is a company called Patient Education Genius. They are a healthcare technology company. And what that means is their sole purpose is to work with healthcare providers, and they want to improve the care and the engagement with the patients. They also have identified that one of the things that's lacking within healthcare, and we also identified this as a barrier, is that healthcare providers often don't collect data on important information. They don't collect data that's going to help them glean information about the families that they're working with and the patients that they're working with, where they're going, how to engage them, those kinds of things. So this particular software has a lot of really cool pieces. The reason why we are using this particular tool is we wanted to create something to target that goal that we had about improving workflow for providers. So providers had indicated that, the system was complex, that they weren't tracking their information, that they weren't able to maybe get information to families very easily, and they weren't communicating with other, they weren't coordinating information relatively easy with other providers or other places where the family needed to go. So we're going to go through this, and we're going to kind of talk about how this is used, but this really simplifies things. It makes things quick and efficient when we're thinking about tracking, but also when we're thinking about referring families to information. And all of these things that I've gone through so far, the videos, the resource repository, the surveys, they're all embedded into this dashboard. And you'll see how we utilize them as we kind of talk a little bit about the system. So the next slide, if you want to go ahead and go forward, what we're going to do is see a little demonstration about the usage, the engagement data. So I'm going to show you the video, and then I'll kind of elaborate after that. Or Danielle's going to show you the video.
Yep, I'll push play here. And if folks could just give a little nod to make sure they can hear, that would be perfect.
What I'm going to be showing you right now is how to log into the Patient Education Genius system. You're going to start here by accessing the link that we'll provide for you. You will have a username and password provided to you. I'm going to go start by logging in with the WSU user account and their password. You click the sign in with email. I will warn you, sometimes it takes a little bit of time. I think they're maybe like 5 to 10 seconds. It's thinking right now, as you can tell, loading. Great, now we're here. We're at the Patient Education Genius homepage. Over here on the left-hand side, you have your surveys and your resource repository materials that you will send to your families as needed. Here's the MChat survey. I will show you how to demo that. I will demo that later on in the presentation. Up here in the right-hand corner, you also can look at tracking to see what's been sent to people and whether or not they have opened your account, and that's how you'll sign out. Going back to your library takes you back to that home page where we currently don't have anything favorited, but this is our PEG homepage, and we'll be showing you a bunch of other things on this homepage as we continue throughout this training.
Okay, so as I said, there's some information on there. Things can be sent directly through this. So this is a dashboard. You log in through your internet service. So it's not software that you buy. It's not anything that you download on your computer, but it's something that you can use regardless of, you know, what kind of electronic medical record system you have. It's high tech, but low tech at the same time. So it's not super complicated. Somebody asked if there's a cost associated with it. For our current partners, there is not a cost for those that are participating with our grant. And for the rest of the year, we are trying to get some other people signed up that might want to utilize this. And for that period of time, there will be no cost. We have negotiated a contract with PEG through MPHI, and the cost is actually going to be very minimal. It's looking to be, I don't know if you have the actual number, but we had talked about $75 a month as a potential cost for this when you contract to use the low tech version. And I'll talk a little bit about those two things. But the way that it stands with the workflow that we've created, it would be about that much. If we are to get additional funding, our grant funding runs out this year. So we'll be having to acquire a cost of the services, but as we get additional funding or if other projects come up, there might be a possibility to extend those things, but that's what we've kind of negotiated as the ongoing cost for the financial aspect. And I'll kind of keep going. We can definitely bring that back up if you guys have other questions, but I want to show you all of the different features that it does. But it definitely helps us to share information quickly. You can log in. And then, like I said, you don't have to have any additional software or anything else. You're just basically buying the usage and the login. This is also, FYI, this is a HIPAA compliant system, and I'm going to show you how information can be sent, and then also how data can be collected, and then how you access all of that. So before I get into the nitty gritty, I do need to explain one of the things that we really worked on with our healthcare providers is developing a way to collect the data from the MChat in a very easy way with the families, something that could be done either live or ahead of time and sent to the families, something that's easily accessible on their phone or on their own portable device that they have at home. So what you see here is what the family would see if they were going to either get this survey sent to them, or in this particular case, we also have what's called a text-to number. So what that means is the families they can see almost like what you guys did with your QR code. You can text a particular number to MChat. And then when you text that number or you text MChat to that particular number, sorry, I reversed that, then the survey will be automatically sent to you. So the utilization that we have come up with so far, and we're definitely open to other opportunities, but one of the pediatric partners that we have, they have put this on a flyer that they're sending to their families so that it can be sent out ahead of time. It could also be posted in the office, or the families can be handed the text-to number while they're sitting in the lobby waiting to get in to see the doctor, so that the particular survey can be sent right to their phone and they can be working on that while they wait. Other things that we've talked about is potentially for some of the community mental health agencies, or some of maybe some of the other bigger global agencies that need to collect this information from people who are not necessarily patients, is maybe putting some information about this on their website, or having, this information so that the families can self-initiate if they would like to take the MChat, and then have that data collected and then sent to that particular provider or network. Then that's also something that can be arranged. So let's go ahead and go forward to the next slide, Danielle. So basically the family is either given the text-to number so that they can fill that out, or there's a place on the dashboard, and we're going to see that as well, where the physician or whoever has the login information can actually enter the person's phone number or email, and then the same survey will get sent to the family. So they can either be sent the information by a provider, or they can self-initiate and they can do the text to number. So let's go ahead to the next slide where you have the video for that, Danielle.
What I'm going to show you now is how a provider would log into the Patient Education Genius homepage and how they will send the MCHAT-R survey. So again, this is your homepage. You're going to go over on this left-hand side. You're going to choose this folder that says MCHAT-R. You're going to click on it here. This is how the folders appear, so you can send the information to a patient. You're going to click the send button here. You can enter in a phone number, and you want to, or an email address, and you want to separate it out by a comma. You can do multiple, you can send to multiple places, a phone, an email. I'm going to show here is how we'll send it to my email address. Again, you can add more than one. You can add in a phone number. You can add in additional emails, but for the for this example, I'm just going to show you how I send it to my email. You click send, so the MCHAT-R survey is going to be sent to my email. It says success, your patient education materials were sent successfully. Okay, I'm also going to then pull up the email that I receive, and I will bring it over to the screen that I'm sharing. So if you just give me a moment, it's currently in the cloud. But it can sometimes take a little bit of time to get in an email box, but it's actually pretty quick. So there's the email that you would receive, a message from Wayne Health. So a patient would click on the message, and this is what's going to pop up. They are then going to see the survey for them to complete, the DWIHN logo, some advertising information for early on. And then if they click here on the survey, it's going to take them to the survey that we've shown you earlier in this presentation, the MCHAT-R form, again, the consent information, and then their information that they'll go ahead and start entering for filling out the MCHAT form. And they scroll all the way down here, and that's how they'll submit it. So again, that is how you're going to go into the folder, and you're going to send it to a patient that way. So you can also view what you're sending to them by clicking that view button. It'll show you what they're going to see. That's another feature. And I believe that's it for now.
Okay. So if we go to the next slide, you'll just see a quick clip of what it looks like if, so you saw what it looked like if it was sent to Danielle's email. This is what it would look like if it was sent to your phone. So you would see a URL link there, and then you would click on that, which then opens something that looks very similar to what you saw in the email message as well. Cool thing is you can send multiple things. So like, let's say there were 2 or 3 things that you wanted to send. You wanted to send the survey and then maybe some additional information, because we have all those things in the resource repository and whatnot. You can definitely send all 3 of those things or multiple things together. You can also send things to multiple patients together. So if you put in, like if you had a spreadsheet that had everybody's phone number and you cut and pasted it and plopped it right into there, you could send them all at the same time. Same things with emails. So there's some really nice associated things that help to save time. One of the cool things about this, when you're filling out the report, if you're the patient, if you're filling this in on your phone or your computer, a lot of people have that function where information is saved. So like it automatically populates a lot of this demographic information if that stuff is saved to your computer. So that also saves the families some time as well. Go ahead and go to the next slide, Danielle. Oh, sorry, one more. There we go. So this is a research project, and this is something that we are collecting data on. So this is something that the families have to have consent. There is consent embedded into this survey for the families. However, if you have families that have difficulty with reading English or understanding things, or if they have a lot of questions, you might want to prepare them for that. That might be something you do with certain families in the office together, or you can let them know that if they have any questions about the consent form or they need any assistance, that they might want to reach out and contact you. So just to kind of be aware of that, that is something that we have embedded into this project, and could potentially be a barrier, but it wasn't something that we were able to get around. So the next slide has some information just kind of on the overall process. So I'm not sure how familiar everybody who is here currently knows about the MCHAT, but there's two versions. There's the MCHAT R, and then if the person scores, there's a positive range, there's a negative range, and there's a neutral range. If they score positive, the information automatically gets scored, and there's an option to then be sent immediately to another facility. So in this case, our two partners that we have going are one of our pediatric partners and DWIN. So the information can automatically populate and get sent right over to Detroit Wayne Community Mental Health, which will then alert them and let them know, hey, we have somebody who's interested and they would like to get an evaluation, and then they can follow up with that person. If for some reason this particular individual scores within the neutral range, there is another MCHAT, which is called the MCHAT RF form, and this is a more extended survey. The survey will automatically populate for those families that score in the neutral range to then add those additional questions on. So the physician does not have to go back and then give another survey or ask additional questions. Those things are all automatically populated within that form. Obviously, the form gets a little bit longer, actually substantially longer. It probably doubles because you have a bunch of follow-up questions that happen. And then that will then give you a final score as to whether or not you are going to make a referral or not. So once all of those questions have been answered, the data then becomes available in a Google dashboard. Again, the system is HIPAA compliant. I can't tell you how all that works because that's not my expertise, but there are lots of documents that show how the system is HIPAA compliant, and the technology people have kind of created all that. But once you hit the submit button, all that goes to a Google dashboard. Once it's in the Google dashboard, which we're going to show you next, anybody who has access to your login can now go in and look at that information. So the physician, maybe the physician's assistant, maybe somebody up front who's kind of monitoring this data, so that when you have people who have identified a concern for autism and somebody is able to follow up with them. So Danielle, go ahead and go to the next slide and we'll take a look at what that PEG demo looks like for the Google Drive.
Yep.
Again, it's Danielle. At this point in the training, I'm going to show you the Google spreadsheet. That's what I'm sharing with you all right now. This is how a provider will view the information after a family or patient completes the MCHAT survey that they provide to them. This is how the fields and the information are going to show up on the back end. Each of the provider offices is going to be given a unique login so that they can log into their Google spreadsheet with their username and password. We're going to provide that to you all in a user quick reference guide. So that'll be provided to you so that you can have access to this Google sheet. But after a parent and family fills out this MCHAT survey, here's some of the demographic information that's going to show up. And if you continue to scroll over, you will get to the actual MCHAT questions. They begin here in column V. And the ones that are in yellow, you'll see are the ones that are reverse scored, questions 2, 5, and I believe question 12. As you continue to scroll over, the information and how a family fills out the survey is going to be down here. These are just test surveys that we've completed out, or that we've filled out to test the survey. And as you get over here to column AP, the total MCHAT score is going to be right here. So this is going to be the total score for the first 20 questions. And if a patient scores in that neutral range, they're going to automatically get the questions for the MCHAT RF. And again, if you continue to scroll over here, you're going to see some of the questions for the MCHAT RF. And if a person leaves any of the fields blank while filling it out, it's also going to show up blank on this spreadsheet. So again, we'll continue to scroll over. Some of the fields are left blank. So again, they're blank on the spreadsheet. If we continue to scroll over all the way to the right, there will be like a total pass fail column that we're still going to have the PEG team make a few last minute updates, and they're going to add that information in here. So there'll be a total pass fail column for quick reference for a provider office. And so that's some of the changes that we're going to be making, but this is close enough to what it's going to look like that we felt that it would be valuable enough to do the training. So that is what the Google spreadsheet is going to look like and how the data is going to be provided to a provider's office.
Okay, so we have since updated that. So our current partners are using it, and it automatically calculates if the MCHAT RF is is populated there, it'll have a score of positive or negative so that the provider knows whether or not they have to make a referral. As I said, we have a current situation where we have a connection between the medical providers and DWIN. As partners come on and onboard with us with this project, if people are interested, we may have other unique connections. So depending on how we evaluate how the system might be utilized by you and your organization and what your needs are, there might be ways to connect with people that you're automatically referring to, or it might be something where we add in a referral to maybe the web page where you choose a particular county or something like that for a provider. So there's a lot of options and a lot of opportunity to individualize that. But those are some of the things that hopefully we can talk about at the end. And Danielle, let's go ahead and go to the next slide.
Danielle,
So the next step really is what happens is the physician obviously is going to discuss this with the family or whoever the provider is that administered the MChat. Somebody will follow up with the family. That's going to be individualized again, depending on you and your office and, you know, your particular services. But the cool thing about this is now we can get out those resources that we've already created and identified in addition through the PEG system. So there is a folder that's inside of PEG where Danielle showed you the resource repository. One of those folders is pre-populated folder number 1. And in that pre-populated folder number 1, if that person has a concern for MChat, or I mean, a concerning MChat that they are at risk for autism, they will get parent videos 1, 2, and 3, which if you guys remember, that's what was the MChat and autism symptoms. How do you access your insurance and get your evaluation? And how do you start thinking about early intervention and services that might be available? They will also get the insurance guidance document, which is the one that we showed you that has the flow chart of how do you then access your insurance depending on what insurance you have. And I think we have also a video showing us how to do that really quickly. So that's on the next slide.
this is the PEG homepage. You're going to scroll down to the left here where you would see pre-populated resources folder number 1, pre-populated resource folder number 2. You're going to click on folder number 1. Right now, and as I mentioned, we only have one item loaded in here, and that's the MICC video number 1, is my child at risk for autism. And you will click on the folder, you will choose the content. If there are more things, you can click on them each and send them separately. This little pops up, and this is how you send the materials. You can enter an email or a phone number. You separate them by a comma, and then you just click send. So for example, I will put in my email address here, and I will then receive a link to the video to watch it. Once this loads, I'll also show you what that content will look like when a person receives it. I'm not sure if you all can see this loading screen, so just bear with me for a moment. Yep, so it says it was a success. So what they will see when they receive the email or a text message is just a direct link to our YouTube channel, and it'll show that video that was created to help direct patients and families.
Okay, so we have 2 pre-populated folders. One is intended for providers to use after a positive MChat, and the second is intended for providers to use following a positive diagnosis of ASD. So pre-populated folder number 2 will have video number 4, which is about applied behavior analysis, and it will also have the ABA guidance document included in it so that families can start to make educated decisions about taking that next step and getting enrolled in applied behavior analysis. In addition, we have all of the resources that you saw in the resource repository that we have outlined also on our website. We have all of those things embedded in the same categories in PEG. So you can open up the folder, you can very easily select one of those resources. And instead of, giving the family the whole thing, if there's something in particular that you want, like, hey, I'd like you to go to the Autism Alliance and take a look at their directory and look for an ABA provider in your area, then you can send them that link to that directory. It goes immediately to their phone, which they then have in their text, which is nice because you can always go back and click on those things as many times as you want. In addition to this, families that engage with these materials, the provider has an opportunity. If you remember in the beginning, Danielle showed us the tracking, and you can actually track whether or not the parent opened that information, whether they utilize it, how much time they spent looking at it. So if you wanted to go back and kind of do a follow-up and see if the family was engaged in using what you sent them, that's another really nice feature about this program as well. Again, we're looking to bring people on and onboard them to this process as additional partners. The things that you saw here were developed specifically for DWIN and Wayne State University Health. If a new company comes on, we would look and see what do you need in your dashboard, what surveys are you going to use, and we would load everything with just what you need, and then we would change the logos and update the information so that the information got sent to where it needed to be sent, and the greeting messages and things would reflect whatever that organization was that now was onboarded with us. So that's kind of the process. Really, the last couple of things that I want to show you is I just want to give you an overview of what this system looks like. So again, we've got a nice little flow chart. So basically in box 1, the family gets sent the MChat. Box 2, the family completes the MChat. If the family then gets a positive MChat, they receive all of the resources, the educational resources. The patient is then, if they're eligible, referred automatically to Medicaid so that they can get access to the additional assessments and things that they need from there. And then the family is receiving like a welcome message all at the same time. So there's a lot of automaticity built into this. We showed you the videos and things that they would get sent. If they need additional services sent to them, again, the physician or the provider can always send additional things like maybe a link to early on or other kinds of things. Once they become eligible, they get their evaluation. Once they get their evaluation, which is an internal process, we don't have that really embedded into PEG. We only have the educational materials to be sent to the families. And then from there, they then get eligible and referred for ABA services. Now, within this system that we created, we also have the opportunity for the families to receive the ABA satisfaction survey every 6 months. So that's something that DWIN is going to be doing, as well as once a year, they're going to be resending out their provider surveys so that they can get updated information for the families about the different aspects and variables of the providers that are available to them. So that's kind of the overall process. Hopefully, what we did within all of these technology tools and educational resources is hit on all those goals that we started with. The last goal, which we had for provider training, we did create one thing, and that's on the next slide. We are working on getting this up as a webinar. Right now we have MChat 101, which is an introduction to MChat screening tool and its importance. This is a 1-hour continuing education for medical professionals. We are available to schedule, if anybody is interested, any live presentations of this. So we can do this either as a live or an enduring. We were hoping to get somebody scheduled as a live presentation and then maybe record it and then post it up on our website for an enduring, but we don't have that scheduled yet. So if anybody is interested in that, certainly you could let me or Danielle know. But once we do that, or if we just end up recording it and posting it up as a webinar, basically our learning objectives for this is participants being able to identify signs and symptoms of autism, participants being able to understand the evaluation and the applied behavior analysis services, as well as being able to administer the MChat R and the MChat RF electronically, and then utilize our MICC workflow and the PEG system to be able to help families kind of take that next step and get into those services. So our target audience for this would be pediatric clinics or other providers that might also administer the MChat would benefit from this as well. So in a nutshell, those were all of the things that we have come up with for this project. Our goal now is really dissemination and sustainability. So I'm so happy that you guys were all able to join us. And at this point, I'm going to turn it back over to Danielle, and she's going to help us kind of talk a little bit in the last 15 minutes about how this might apply to you.
Thanks so much, Krista. So I know that was a lot. We've done a lot, right? So there's a lot of information, and I saw some of the chats. We'll be sure to distribute this PowerPoint, and again, our resources will be updated on our website. We'll send out some communications to everybody once things are the next videos are posted. But we wanted to get some feedback from you all, and we wanted to do a little interactive component. I like to kind of spice it up in these virtual Zoom world that we're all living in. So we used a QR code before, and we're going to use a software. It's called Mentimeter. So if you wouldn't mind thinking about this question and maybe putting in your answer, and what'll happen is we'll see your responses live. I'm going to stop sharing the PowerPoint once you all kind of get that up. But if you just hold your cell phone over that QR code, a question's link will pop up for you to kind of type in a response to that question, which is based on your experience and how might this workflow help improve care coordination for you? So if you wouldn't mind taking a minute, the link is also right here. I'm going to drop that I'll drop it into the chat if folks might be on via email or with their computer. Whoops, sorry. Can you all still see that? Let me drop this into the chat to everybody really quickly. So yeah, if you all don't mind kind of providing some responses there, and I'll kind of take a look and see if we're having any responses coming in live, and I will share that with you all as we go. So again, the question is based on your experience, how might this workflow help improve care coordination for you? Oh, we're getting some responses, so great, thank you all. Is anybody having any trouble accessing this? I'm also gonna put the QR code into the chat, and then I'm gonna switch screens for you all, but I wanna make sure if folks are still accessing it, that it's there. So maybe I can't paste a picture into a Zoom chat. That is something I didn't know. So something I just learned. But we do have some responses, so I'm gonna actually just bring this over in the interest of time. So I'm going to kind of stop sharing that. I'll bring this screen over and I'll kind of switch. If anybody needs that QR code, can you just drop that note into the chat and I'll get it up, or I'll get it to you that way. So I'm going to share our responses that are coming through. So can you all see that? Again, so based on your experience, how might this workflow help improve care coordination for you? Some of the responses are, I would like to share these materials and workflows with our Help Me Grow affiliate care coordinators as a learning opportunity for them. I will share with consultants at our ISD who work with 0 to 3 population, another tool or resource to share with parents, hoping it helps family receive services early on and have that education at the forefront. I love the automaticity. I think it should be very helpful. Resources will be used for medical students. Folks open to leverage technology. So we're getting some responses. Awesome.
I'm wondering who was the person who said that they would be sharing it with the ISD population? Would you be willing to maybe unmute yourself?
Hi, this is Colleen. My name's Colleen Mesler. We're at the Oakland ISD.
Okay,
And,
awesome.
Yeah.
Do you know if they actually do they administer the MChat there, or what types, like how would they potentially use that?
So I'm not super familiar with that portion of our ISD, but the way our ISD operates in Oakland County is that we support our 28 local school districts and PSAs. And so we don't directly administer assessments and surveys and such, but they do have 0 to 3 consultants and people that help parents with that referral process and then early on. So yeah, I just want to make sure I'm sharing this with the right people within our organization to make sure that we have like an early childhood special education consultant. Shared this webinar with her. She's going to be attending probably the next one.
Oh, great.
And our social worker that communicates with social workers out in districts. So
Well, certainly if you have any conversation, definitely let them know that they could reach out to me or Danielle. One of the very cool things about this project is it's been very organic. So as I said, when we started, we really assessed the needs of all of these different community providers and these different community organizations. And if they look at this and they go, wow, this is really cool, but I'd like to know what the but is, which is kind of why I asked the question, like, is there something, like, would they use PEG? Would they just use the videos and the resources and email those out? Or like, how could we make it so that the information gets to the people that they need to get to? Are there other resources that need to be added on? Like those would be the things, because we've had a little bit of engagement from some folks from Help Me Grow, a little bit from early on, but I certainly would love to hear from Oakland County, from the ISD, if there's anything that we could do differently or add on to this with their help. That would be awesome. So definitely feel free to let them know that they can, if they show up and they come to the next meeting, or if they want to chime in, or even if they can't and they want to contact us at a later date, I'd love to have a conversation. That would be awesome.
okay, excellent. I will share that. And also I have a quick question. And maybe I missed it earlier, but was one of your stakeholders the Michigan Alliance for Families?
We did have some representation from them. They were not always at all of the meetings, but I think we had, that was mostly from our advisory board.
Okay, thank you.
Yeah, sure. No problem.
And at this point, we only have a few minutes left. So thanks for playing my game with the virtual interaction soft component. But if anybody wants to elaborate on some of their responses or provide any feedback to Krista or myself about how this workflow might help to improve care coordination for you, we can just open it up at this point. So feel free to unmute yourself or add a note to the chat and we can just have a brief discussion.
I feel like I should know the answer to this, but who were you talking to at Help Me Grow?
So we had a couple representatives. I believe her name was Amber Anderson, and she was like Wayne County.
Yeah.
She was involved early on a couple of our meetings, but unfortunately, when school started last year, she wasn't able to continue to work with us because she had like a lot of kids.
She has a lot of kids.
Yeah.
So we haven't spoken to her in a little while, but I believe, were you our connection from Nikki?
Yes. Yeah.
Yes. So we have a meeting
Hi.
scheduled coming up. So I'm excited to talk to you. I figured I'd wait to talk to you first before circling back around, because I didn't know if you were like higher up on the food chain or if there was somebody else that we needed to engage. But she was interested in the project, but didn't really have the big picture before she left, because we were still kind of in the development phase. So she has no idea about any of this stuff at this point, I believe.
Awesome.
Yeah. So what are your thoughts after seeing this? Just a little tidbit. I don't want to take up everybody's time, but do you have any thoughts about what we might be looking at for our next meeting?
I mean, I definitely think the materials are amazing and definitely want to get those out to anyone that we can get them out to. I love the platform. As someone who's tried to get other people to use online platforms, I just know that the problem is there's so many and they don't communicate. So I guess that would be the drawback. And cost, which I was the one who asked about cost. I mean, $900 a year is not that much. So I mean,
our goal was to really make it as low cost as possible. But the reason why I kept kind of referring back to Wayne State and DWIHN is because we set up an automatic communication between the two of them. So actually at the end of the MChat survey, it says, are you Medicaid eligible, or would you like to find out if you are, basically something like that. And if they click yes, then that data automatically goes to them through some coding connection that the technology company set up for us. So if you were in partnership with somebody and we were able to get you an account and them an account, then we can have that information maybe transferred or communicated. But that's where the onboarding process comes on. And if it didn't, what our thought was, is that instead of saying, you know, are you Medicaid eligible? We might have a closing document at the end that just had like a link to how you get more information from community mental health, or, you know, like having some informational something that the family could then just click on and go right to another document, rather than somebody receiving that data. Because if somebody receives it, they then have to do something with it. So with DWIN, they get an email alert, and then the goal is for their folks to then get into the system and then contact the families, because in particular in Wayne County, the pediatric offices that were working with DWIN, they would send them a paper referral and then the family would never get there. So we were trying to kind of close that gap. But other ideas that you have with, you know, referral sources that you might have, we certainly could talk to them and maybe brainstorm about how we could do something similar. Or if it doesn't work, obviously the resources and other things might. So certainly that'll be interesting to learn more about your system. Quickly, we have a couple more minutes. Does anybody else have any questions or any comments before we end? Okay. Well, I am so happy that you guys could all come. We did record this. We have one more. If you guys know anybody who would like to attend the second one, you can forward the information that you received, or you can send them directly to Danielle. We can help get them signed up. So please take a minute to kind of think about anybody that might benefit from seeing this within, you know, all the different people that you know out in the world. And then once we do have the recorded version, we will definitely alert everybody who attended in case they want to refer anybody else to this information that couldn't attend either of the trainings. But thank you all very much. And certainly if anybody has any questions or anything that they'd like to set up a follow-up meeting to kind of discuss something in more detail, we're very open to that.
Yeah, and thank you all so much. I put our website, our YouTube channel, the QR code for our website on this final slide, and some of our social media handles. If you're interested in following, when I distribute this PowerPoint, that information will be out there. So again, thank you all so much for your time. Krista, do you have anything else, or are we?
No, have a great afternoon, everybody. Thank you so much.